Welcome to the 2020 DC Retail Summit. Today, our topic is going to be employer to employee public health and safety. And I have to say, I'm so honored to be a part of today's discussion because this topic has become so important, and it's one of the #1 concerns plaguing workforce development today. And it's even more plaguing our underserved communities. As we all know, COVID-19 has disrupted our regular routines, shut down our schools and our workplaces, and made terms like social distancing and flatten the curve part of our everyday conversations. Unemployment rates have soared through the roof, and working remotely has become the new norm. So many people are scared to return to work. They're scared that their employers cannot keep them safe. There's still so much we don't know. And conversations like these definitely need to be had because they're so crucial for us to be able to come together and not only restore, but maintain safety in the workplace. Just a little housekeeping, a few housekeeping items, sorry. Make sure that your mics are muted unless you're speaking. Also, make sure that you drop all questions for the presenters in the Q&A section. We'll try to get as many questions answered as we can after the discussion. And if you require ASL interpretation, please look in the chat for the link. Okay, now I'm going to introduce our panelists. I would like to first introduce Erin Moriarty. She is Human Resources Specialist with George Washington University's Milken Institute School of Public Health. We have Arian Gibson, who is Associate Director with DC Health Office of Food, Drug, and Community Hygiene. And Dr. Reed Tuckson, who is founder of Blacks Against COVID-19. Please welcome them all. Welcome, guys. So glad to be here amongst you guys. So first, I'd just like to ask each of you to give just a little background on how you got involved in public health and safety.
Well, so I'll start then. My name is Reed Tuckson, and I am the former Commissioner of Public Health for the District of Columbia. I was privileged to serve in that role during the height of the HIV epidemic, and I got involved in this effort with my colleagues creating the Black Coalition Against COVID, because we knew and understood that if we are to mount a campaign against a pandemic of this size and virulence and import, that it will require the grassroots community across all of our populations of different kinds of community infrastructures within the city to partner and support the excellent and wonderful work of our public health department.
Awesome. Erina?
Hi, thank you for having me here today. I first got involved in public health through schools of medicine and schools of nursing and the health sciences as an educator. I ran student services and academic programs in various schools of medicine and health sciences and nursing. And now I'm with the School of Public Health in an HR capacity. So I've always been involved in health and public health related education, but my role has switched to now my focus is on employees and employers rather than the student experience.
Great. And Arian?
Yes, good morning, everyone. So I've been in public health my entire career. I started off as working as a sanitarian early on in my career, and then I progressed. I've worked with public health as pertains to food program, environmental health, medical marijuana, just a variety of public health fields. And so now I'm the Associate Director of the Office of Food, Drug, and Radiation within DC Health. And I have served on things such as the Reopen DC Committee.
Awesome. And I'll start with Dr. Tucker again. What is the greatest challenge you are currently facing?
I think the greatest challenge that we are facing is the extended period of time that we have been struggling and will have to struggle against this virus. We all know that the challenges of maintaining fidelity with wearing our mask every time we go out, with maintaining social distancing, with frequent hand washing, and now also supporting the efforts of contact tracing. All of those efforts, people are tired. There is a weariness. And so the challenge that we have is to continue to create and reinforce a culture within the community that gets everyone staying the course. And this is particularly difficult with the almost insane leadership of the federal government, with all of its mixed messages and confusions, with its playing around with facts and data. But yet, despite that, we have to continue to make sure that we are prepared for a long haul, and that we have to make sure that we are prepared to save our own lives and save our city in the midst of this confusion. So I think the biggest issue going forward will definitely be having the emotional, spiritual, and other resolve necessary to do the right thing for a little bit longer.
Amazing. Yes, I agree. What about vaccine development? I would love to know your thoughts on that, Dr. Tuckson, sorry.
Well, the vaccine development is very important, and I do serve on the committee that is about to finalize its recommendations on behalf of the NIH and the CDC on who should get the vaccine once it is made available. And so I have a very intense interest in this issue. Let's be very clear. The vaccine will not be available to the American public or to the citizens of our city until 2021. Be very clear about that. Number two, be very clear that there is, in my opinion, and knowing the scientists within the CDC and the FDA, we will not be releasing vaccines into the community that have not been appropriately tested for safety and efficacy, despite the concerns of the president and what he says and the confusion that he sows. Number three, the vaccine is not the panacea that ends everything. Be clear that the vaccine will be important, but that in that regard, we will still be needing to wear our masks and social distancing throughout the majority of 2021. This is not a magic bullet that will just suddenly make this thing go away. We're going to be in it for the long run. And lastly, the thing about the vaccine that this community will have to struggle with the most, and it's right in front of us now, is whether we will have enough people of color participate in the clinical trials that will be able to demonstrate that the vaccine is safe and efficacious for our people. Knowing how we have had bad experiences in the past with the Tuskegee syphilis study and others that people often bring up, this sense of distrust in science is a scary proposition, because as we continue to live in the past, we're not preparing ourselves to take advantage of science and technology in the future. These are the big issues, I think, related to the vaccine.
Wow, I agree. Erina, do you have any opinions on the vaccine development?
Yeah, I do, though I don't. I'm not the expert. I agree with everything that Dr. Tuckson just said. Mm-hmm. And from everything that I understand from the public health experts that I work with at GW, it's definitely going to be 2021 before things are distributed for the general population. I am proud to say that at the GW School of Public Health, we are one of the testing centers, clinical trial centers, and one of our goals is to make sure that Black people and Latinx people are properly represented and have trust in our health professionals and the way that we are running our clinical trials, because that's very important to us, to remember our history and make sure we're not repeating it, to have trust in the system and for the people participating to trust us, and to make sure that we are doing our best to make sure that genders, age groups, and different race and ethnicities are properly represented. Or since our population is Washington, D.C., we want to make sure that Blacks and other people of color are overrepresented, because they might not be in other parts of the U.S. So we need to do our part to go above and beyond.
And how about you, Arian?
Yes, so I definitely agree with all of what both of our panelists just stated. I think the major thing is trust. Is for our community to trust to actually take part in these vaccines. We've had so many issues in the past. It's just about trust, and it's about having one strong message. I think early on there were some mixed messages because it's new. We didn't have the science to back up a lot of recommendations that we've submitted. So the community is a little wary of what we're saying now. So I think it's just about building relationships and building trust.
I agree. In the community, in the African-American community, I do see a lot of us are really scared about the vaccine that's coming out. There's a lot of fears, a lot of people saying they're going to, force our kids to get a vaccine before they can go back to school next year. A lot of parents against, giving their children the vaccine. So there's definitely a huge fear in the community about the rapid development of the vaccine. So
I think that's important, Aisha. Again, we have real reason for anxiety based on the past, but also based on the comments by the president. But what I would hope that we would not do is to almost, and it's kind of almost diabolical, because of the actions of the president, many of us are rooting against the vaccine. So you have to think to your mind, well, what's the end game here? How long do we think we want to continue to wear our masks? How long do we want to be social distancing? How long do we want the schools to be closed? How long do we want people not to be going into our retail establishments? And so it's almost as if we're rooting for the wrong team. And so I would just urge us all to take a sober look at this. No question, there's lots of work to be done on trust. And I'm fortunate enough to be involved with other physician scientists who will be in a position to look over the shoulder of the FDA around the data and making sure. I guarantee you, though, that if the president tried to put out a vaccine that did not pass science, the scientific community would certainly be in uproar and revolt, and no physician would recommend that any patient take it. So be very clear. But my point ultimately is this: we cannot afford, especially our community that is dying faster and more than anybody else, with people of color being the ones who are showing such high death rates. We cannot be the ones to root against having a vaccine that can work and that will be safe, because the consequences are more death for us. And of course, it means that our society does not open up. And I, for one, am not looking forward to wearing my mask for the next 5 years.
Yeah, I agree. So there has to be a lot of community education that takes place surrounding the vaccine, because right now there's a lot of uneducated, opinions about the vaccine that aren't driven by knowing the facts around the development of the vaccine. So
I don't want to monopolize this part of the conversation, but let me indicate that we convened last Wednesday and Thursday night a national town hall. The Black Coalition Against COVID convened a national town hall broadcast on WHUR and broadcast to more than 100,000 people around the country through blackdoctor.org. This meeting had all four medical schools, historically Black medical schools: Howard, Morehouse, Meharry, and Charles Drew in LA. We had the National Medical Association. We had the African-American leader of the National Heart, Lung, and Blood Institute, along with the official of the FDA, who is responsible for signing off on the safety and efficacy of the vaccine. I would urge all of you who would like to hear what Black scientists have to say, Black physicians, all of our Black medical schools saying about this, go to our website, Black Coalition Against COVID.org, Black Coalition Against COVID.org, and you can download that town hall. It was a 2-night extravaganza, and a lot of information is there to help people.
awesome. That's amazing. Thank you so much, Dr. Tuckson. All right. So the next question, how can the workforce system advance workplace health and safety during and after the pandemic? Erina, I know you were open to answering this question. So can you please give us your...
Yes, I think, first of all, in any situation, especially now, though, there needs to be trust and clear and open communication between employers and employees. Just communicate, communicate, communicate. And in this type of situation, I think it's ideal to have a checklist that is developed by employers and with employees' input as well, for step-by-step, what is the plan to reopen? What would it take for us to feel safe? What would it take for our customers and patrons to feel safe coming back to our establishments, especially in a retail and restaurant environment? I think it's more critical than ever for employers to be aware of employee morale and let them know what's going on, involve them in every step of the planning so that they understand what the new rules and expectations are, closely follow DC guidance, and then again, involve your employees, because they may help the employer think through things in a different way and have a different perspective. Where it's feasible, I encourage remote work and using new technologies. I know this isn't feasible for many essential workers and other types of businesses, but wherever it is feasible, implement it, adopt new practices, adapt old ones. Again, such as remote work. For restaurants, this may mean developing their own app for online orders, or partnering with, one or more delivery services, offering curbside pickup in addition to regular takeout or delivery to limit physical contact. Obviously, wear masks, wash hands, wear masks, wash hands, wash hands, wash hands. And some new things include, which I don't know how many people have practiced this, but until we do have a COVID-19 vaccine, encourage your employees to get the annual flu shot. This is critical, especially as we enter the flu season, because there is, evidence that you could have both, and that would really be devastating for someone to have both. So we can at least protect ourselves with what we already know and have a vaccine for. These are good practices to have in place. Mask wearing may become the new normal. I think a lot of people are getting more used to it. And perhaps we will reach a point in American society where, hopefully we won't have to wear it every day as we do now, but it may become more commonplace, just as it is in some countries like South Korea and Japan, where, for seasonal flus and other things, it's, habit to wear masks and it's not viewed as unusual. And I just can't emphasize enough that employers should trust their employees and have clear communication. And if you have employees with any concerns about their safety, listen to them, because they may be, legitimate concerns that you're able to work through together and make accommodations in the workplace to keep yourself, your employees, your customers, and patrons safe.
I think Erina has really, I'm sorry, Arian, is that you? Okay. I think that Erina has made some very important points, and I want to underscore the one about the flu. I don't think that people really focus in on how devastating the combination of the twin epidemics are going to be. Having the COVID epidemic simultaneous with seasonal flu is a dire concern. We know that on a normal year, less than 30% of the Black community will get immunized against the seasonal flu virus. This is not the year to turn away from the seasonal flu vaccine. We are very concerned that as we go indoors, and as the season now, as we move beginning indoor with the colder weather, we will have more transmission of COVID, but we'll also have more transmission, of course, of the flu. And there will be very confusing symptoms because they're so similar. I fear that we're going to put a terrific drain on our emergency medicine capability and our health delivery system as both of those come together, not to mention the weakening of individuals from the seasonal flu, making them more susceptible to COVID. So please, everyone needs to go forward. But the bigger point, in addition to what Erina has said, I want to really step back and realize If you really care about whether or not our schools reopen, if you really care whether our businesses reopen, then you will be the strongest advocates for the community mitigation efforts. You will become the strongest advocates for, as Erina has said, wearing your mask, social distancing, washing hands. I think we have to understand that employers have a big stake in the community environment in which employment occurs. We were fortunate, the Black Coalition Against COVID, early on to partner with Antoine Ford and Corey Arnaz Griffin and Phil Reeves of the Black Chamber. And we had them go and make PSAs on the radios around the city, talking about how important it is to do these very things. We have been very fortunate to work with WMATA, and having on our metro system, we partnered with Big G Antoine Glover and the Backyard Band to be able to put on in the metro systems around the area, Antoine Big G Glover wearing a mask and saying, "I'm wearing mine, you wear yours," as a way to protect not only the metro bus and train operators and the workers in there, but also to spread the message throughout our community. My point being that the business community needs to be very, very involved, doubly involved today in working with everyone to leverage the community message and create a community culture. Without that, you can't succeed on your own.
Great. That's great insight. Yes, I agree.
And if I can add to that really quickly. So what we have observed throughout the facilities that we regulate in DC Health, which includes restaurants, barbershops, salons, things like that, is those facilities and those owners who have went for the long-term goals. They took their time reopening. They came up with a plan. They are screening their employees appropriately. They have been open and they've been operating very successfully. To contrast that, those facilities that have rushed to reopen and was going for the short-term goal of just, I need to hurry up and get in business and make money right away, those are the ones that we have seen outbreaks and spikes and peaks and things like that. So I think it's incumbent on the owners of the facilities and the corporations to really come up with a sound plan on how to prevent the spread and how to protect their employees.
Great. Due to occupational segregation and other factors, Rooted talks about how Black, Indigenous, and people of color have been more likely to endure severe health consequences from the virus. Can you guys talk about that? How Black, Indigenous, and people of color have been more likely to endure severe health consequences from the virus.
Well, the challenge is that we're having a hard time enduring it. We're dying, we're suffering. And the reasons, of course, are not because of the color of our skin or the genetics of our makeup. It is because we're the ones who are on the front lines in the retail stores. We're the ones who are operating the metro buses and so forth. We're the ones who are living in, because of the history of systemic racism, in overcrowded housing where we're all clustered together. These are the reasons that we are facing these kinds of challenges. And so I think that one of the things that we did with the Black Coalition Against COVID was to create a town hall with labor. One of the people who is on our steering committee is the inimitable and outstandingly wonderful Josh Williams. And so Josh is part of our coalition. And in our town hall, there were people who were, I remember distinctly, a metro train operator who said, you know, we may be essential, but we're not disposable. And that really got me, because it's sort of saying to us that they were so frustrated by people walking into the grocery store, not wearing their masks and being rude to the people working when they demanded that they take the appropriate steps to protect not only themselves, but the grocery retail clerk. So my point being is that we are really the ones in harm's way. And we're the ones, of course, who have the pre-existing conditions because of so many years of neglect of our health and the infrastructure needed to support optimal health. We're the ones who have the risk factors that put us in harm's way. So I would suggest that we are not enduring, we're suffering. And what we are going to need to decide is to come back to this notion that we are one community, that we are all in this together. And it is a tragedy for one of our retail clerks in a grocery store mentions that when she goes home at night, she takes off her clothes in the hallway because she's so terrified of what she may be bringing into the home with her small children. We are all in this together. And if there's anybody out there who is not being a part of responsible behavior, particularly inside of business establishments, then we have to hold those people accountable for that behavior and tell them you are not allowed to be so self-absorbed and narcissistic that you would risk the lives of the good people out here who are trying to provide services for you.
I agree.
Thank you, Dr. Tuckson. I did just want to follow up to comment that it's so hard. We are living through a pandemic within a pandemic. And what people have not realized before, but they need to realize now, is that racism is a public health issue. I hope that as we are going through, as there's more awareness and we are all living through the second civil rights movement right now, that more white people and non-Black people of color are recognizing that all of us, everybody, we are the public together, and that as the public, we must proactively be involved in ending racist health disparities and work together. As Dr. Tuckson said, you can't be narcissist, you can't be selfish. Like, we are the public, we are one community and should be acting as one. You can't say that the racial health disparities that are affecting since the beginning, just things like wash your hands, wear masks, maintain, the physical distancing, and don't try to break rules because you think they don't apply to you. And employers, take care of your employees.
Thanks, Erina. Arian, you care to touch on that topic? Can't hear you.
I think that Erina and Dr. Tuckson summed it up perfectly.
Great. Okay. All right. So the next question is, what roles do we want private businesses to play in supporting a thriving future of work? Arian, what roles do we want private businesses to play in supporting a thriving future of work?
Yeah. So I think that private businesses really need to step up in the sense of taking care of their employees. Even as this outbreak continues to go on, employees, if they trust their employers, they will come to work and they will do what they have to do. But if they don't trust their employees, if their employers aren't providing insurance or basic things such as sick paid leave, and then their employees are not going to put themselves at risk during a pandemic to come to work and to continue the development of that particular business. I just think it's a trust issue. Employers really need to show that they actually care for the well-being of their employees.
Well, I think that's such an important point. And this is the time, hopefully, that those bonds of relationships between the employer and employee are strengthened. This is certainly the one of the, I think, positive benefits of a crisis, is that it at its highest level brings us together. I really think that also the point that Arian makes, which it really should be underscored, and that is making sure that the access to insurance is viable. I think that we have to be very attentive, and this city's business community will need to be very attentive to what happens with the Supreme Court decision coming up right after the election on the Affordable Care Act. It is almost inconceivable that a United States president would challenge the Affordable Care Act and its prohibitions against denying insurance to pre-existing conditions in the middle of a pandemic. I want you to just think, as employers, think to the future. You're going to have a lot of people who will have survived this virus, but who will have lingering health problems. I think people need to remember, COVID is not like the flu. This is a disease where a significant number of people will have lasting health consequences from their exposure to this virus. What will happen if there is not a prohibition against denying insurance for pre-existing conditions? So this is one of the challenges that the employer community in this city will need to be very attentive to. But lastly, I think Arian also got to a critical issue, and that is, how do we in the future make sure that our wellness policies, our health and wellness initiatives are as robust as possible, so that our workforce, when it comes back in full flower, will be able to be as healthy as possible, not just from the COVID vaccine, but their overall healthiness in general. And so the workplace health and wellness strategies will be, I think, also very key. And then finally, of course, so many of our businesses realize that we're not going back to normal, that there will be an innovation in the way work is done in many different sectors of our economy, and embracing that new innovation and preparing the workforce for that innovation will be one of the exciting challenges as we start to look to the future, not as victims and not as, oh my God, look how horrible things are, but look to the future with a certain sense of optimism. Innovation always spurs energy. Innovation always spurs positivism. And I think that the opportunities for innovation ought to energize everybody.
Thank you,
I
Dr.
agree with what Dr. Tuckson and Arian have said. If there has to be trust and communication and innovation. And one of the things that many employers, if they don't already realize it about themselves, is that they are community leaders. And so if this isn't something that they've known, if this wasn't a role that they saw themselves in, then they do need to step up and recognize that they are an active part of our community and they need to be the leaders, especially in a situation right now where we are getting mixed messages or no messages and guidance from national leaders. So we need to depend on our community leaders to keep ourselves, safe and keep our businesses and economy going in a safe way. And I love Dr. Tuckson's emphasis on innovation. That's something I know in my own personal workplace, where some people had been resistant to the idea of remote work, and we've been doing it very productively and successfully. And just an example such as this panel, where I don't know that all of us would have been able to be brought together for a panel at the same time on the same day, given everybody's, other work commitments. And yet here we are, and we have all of our wonderful, listeners who are participating as well. This is definitely an innovation that I hope is expanded and kept. Things like, for me as a consumer, I'm loving curbside pickup and many of the delivery options from restaurants and retail stores that might not have participated in the past. There was one store, Kramer Books, which I think is pretty popular in DC, where I ordered a book and I ordered a burger in one order. I love that. So these are things that I hope continue, that there are many positive things that can come out of this to really innovate business. And yeah, we're never going back to the before time. So it is like, how do we make things safer and better, but also hang on to some of the innovations that have come out of this.
Thanks, Erina. I have another question for you. So, a worker says to their employer, I just don't feel safe coming to work. I don't feel comfortable. Is this a valid reason to not come into work?
Yes and no. It's not an easy yes or no. The first thing that I recommend in any situation, but especially now, is to listen to their concerns, actively listen thoughtfully and with empathy, especially now. What is the employee's, specific fear or concern about returning to the physical workplace? Is it reasonable? Have the concerns perhaps already been addressed by the employer, but maybe not to the employee's satisfaction, and are additional steps needed? I believe just often having honest, open communications can really show your employer that you respect their fear and you respect their opinion if they have ideas on how to make things in the workplace safer, better, more innovative, and it'll avoid any unnecessary escalation. Your employees may help you think through adaptations to your business process, to the physical, navigating the physical workflow, walking flow of a retail space or a restaurant. Your employees may, be on the ground and be able to see things more from a customer's viewpoint as well. Like what would work when we do want to bring people back inside, or what can we do to bring things outside to them, and things that maybe not everybody has considered before. I do recommend, being, as we had already talked about, paid sick leave. It's take advantage of that. Hopefully you can offer that. There are also DC and national standards regarding sick leave. And if it's still a situation where the concern can't be mitigated, employers do need to tread cautiously, as employees do have many legal protections. In general, in the before times, an employer could discipline an employee for violating an attendance policy, for going AWOL, just refusing to work. But there are exceptions to that rule, even in the before times. And now we're living in an exceptional time period. So what are some of these exceptions? For example, employees can refuse to work if they reasonably believe they are in imminent danger, according to the Occupational Safety and Health Act. This means that an employee can refuse to come to work if the employee has a specific fear of infection that is based on fact, and not just a generalized fear of contracting the infection. And if the employer does not or cannot address the employee's specific fear in a manner that's designed to ensure a safe working environment. Accommodations can fall under the ADA, the Americans with Disabilities Act. There is COVID-19 guidance that notes that accommodations may include things, changes to the work environment, such as reduced contact with others, the physical distancing we've talked about, using plexiglass barriers and separators wherever feasible, whether between workstations, between your employer and a paying customer, in a restaurant environment. Make sure everybody is wearing masks. Even your patrons should be wearing masks during the time that they are being seated and ordering and waiting, and only remove masks for drinking or eating. But otherwise, even as they're sitting at a table, they should be wearing masks. I recommend employers be flexible to responses and to any requests for leave from vulnerable employees, especially older essential workers. It's the right thing to do. It improves trust, employee relations, and morale among your workforce, especially, longtime employees that you don't want to lose. And if a healthcare provider advises an employee that they need to self-quarantine because they're a vulnerable population or they've been in contact, then, they may be eligible for paid sick leave. And as I've said before, just communicate. Employers should keep employees apprised of all measures that the employer is taking to maintain a safe workplace, and being consistent with guidance from CDC. Though I do understand that can be confusing, since the CDC isn't always consistent in and of itself, but follow DC government. I feel like DC has been consistent, and the guidance is very good that we've received from DC government. And some of the things that DC government advises is implementing leave policies that are flexible and non-punitive, and actively encourage people who are sick to stay home, account for things, employees who report COVID-19 symptoms or who are tested for COVID-19 and the results are still pending. Allow them, flexibility to stay home until they know for sure they have a negative result. If they've tested positive, you may need to implement, a 2-week quarantine period. If they've been in contact with someone who tested positive, especially if they're living in the same home. Be flexible with employees who, may have small children that aren't going to school or their childcare closures, and you need to make accommodations for that. And employers do need to keep abreast of what the current law is, which has been amended during this period. Both the DC Family and Medical Leave Act, as well as the DC Sick and Safe Leave Law, have included new categories of leave, such as declared emergency leave during this COVID-19 period. I don't know if that answers the question. I mean, above all, know that employees do have many rights. Be flexible, be non-punitive, listen to their concerns and their ideas. But then you also have to follow just some guidance that's always been in place during ADA, which is any accommodations do need to be reasonable.
Aisha, I'll just add 10 seconds only to what is a very comprehensive and appropriately detailed response. And that is that this conversation that employers need to have with their employees on the facts. And so if you need, Marie Johns, who is well known to the business community, is a member of our steering committee, and she has emphasized to us, as she's a leader of our Black Coalition Against COVID, how important it is to supply trustworthy information. So I would say that if you need to have more information about some element of the science of this COVID pandemic, certainly turn to the DC Health. Our DC government is doing a terrific job, I believe, but also you can turn to us. I will put my email address in the chat line, and you can also send to us questions that you do not feel are adequately answered. We have a team of physicians standing by who are prepared to serve your needs and provide you with fact-based, evidence-based information that may help you in that conversation with your employees.
Wow, that's amazing. Thank you, Dr. Tuckson.
Just to add really quickly, so it is really crucial for employers to get the knowledge out to their employees. Lack of knowledge breeds fear, and early on, that's where we saw a lot of fear because people just did not understand what was going on. Additionally, I would think it's important. A tool that I use with my team is I came up with a plan together with the team. So when people are inputted into the process, they are more likely to trust the process. They are more likely to buy in. So I think it's very important to come up with a plan with your team member if they are nervous or afraid or apprehensive. So just come up with a plan with them. Ask them, well, what do you think about this? Check in with them every week or two to see how is this working? Can we do something differently? Can we do it better? So they are on the front line, so they know day-to-day operations. So I think it's important to be inclusive with your team members.
Thanks, Arian. Also, Arian, are you able to offer some current best practices and requirements for retail and restaurant owners to maintain?
Yes. So I would like to say that the restaurant industry was ahead of the curve from other industries because a lot of practices that they already practice for food safety, those things were already in place, and those are the same principles that we use for to combat the spread of coronavirus. So things like properly washing and sanitizing equipment and utensils, things like proper hand hygiene. The restaurant industry washes their hands probably more than anyone other than nurses and physicians and healthcare practitioners. So those type of things made it not an easy, but an easier transition for the restaurant industry. So those are the things that are really important: properly wash, sanitize, obviously the social distance, hand hygiene, things of that nature.
Thanks, Arian. What do you guys wish every business owner knew? We can start with you, Dr. Tuckson.
Well, I think, first of all, I wish that they would know that we care about them, that we have an extraordinary amount of empathy for what they are going through. I cannot imagine the kinds of pressures on business owners today as they try to navigate these very difficult times and keep their businesses afloat and maintain their allegiance to their employees and try to help them to maintain their salaries so that they can keep their mortgages paid and be able to live their lives. So first, you need to know that we care. Number two, I come back to the main issue that I think that you need to know that your success depends completely on what happens to the people around you, the people that are in your community. And so that you have to continue to be adamant and strong voices in the larger community conversation. And what that really means to me in practical terms is you cannot do this by yourself. You have to be part of coalitions, or parts of groups. You need to be in close dialogue. We're going to be reaching out to our colleagues at the Black Chamber and Labor to have a combined labor and Black business town hall. I think we're going to need to bring those two communities together in a very powerful way. I know that Josh Williams is, I think, interested in this idea. I think we have to be able to connect the business community and our church community. We have to be able to connect our business community and our entertainers. In other words, we have to come together as one gigantic whole and realize not just some kind of rhetorical flourish that we're all in this together and some abstract kumbaya, but a real practical initiative that leverages resources and leverages conversation and behavior so that we change the culture of our community, a culture that is going to fight for doing the right things. That to me is the beginning and most important thing.
I'm sorry, Erina. What do you wish every business owner knew?
Well, for starters, if they don't already know it, I hope every business owner knows the DC government resources, specifically on the website coronavirus.dc.gov. And I posted a link to it in the chat that should be open to all attendees. There's a lot of wonderful guidance, especially for retail and restaurant businesses, that even includes, different layouts and how to reimagine, their businesses while still maintaining physical distancing and safety for themselves, their employees, customers, patrons, and the community. And I think I've said it multiple times, I can't emphasize enough just transparency and clear communications between employers and employees. Be honest with each other on expectations, guidance, and any fears that you have. And I think this is a time where employers need to be extra flexible and empathetic to their employees who may have legitimate fears and concerns about their safety and their family's safety, but also realize at the same time that employees want the same thing that their employers want, which is success. They want to keep their jobs. They want to make sure that the businesses keep going and are viable in this new economy, and that this is new for everybody. I don't know that, I think this is for most people's lifetime, this is the event. And so we're learning together, and just listen to science, fact check things, listen to multiple scientists. If you hear something in the news and it's only being said by one person, maybe check to see if there are multiple scientists backing up the same thing, so that we can all be practicing the real best practices for health and safety and returning to physical workplaces.
Thank you, Erina. All right, it's time for a poll. Coming up right after this. All right, so here's our poll. What level of investment has your business made in safety equipment and supplies due to COVID-19 to protect your employees and customers? Less than 10,000, 10,000 to 24,999, 25,000 to 49,999, 50,000 to 100,000, more than 100,000, I don't know, or NA. Please quickly fill out your response. Thank you. All right, so the results are in. So it looks like for the question, what level of investment has your business made in safety equipment and supplies due to COVID-19 to protect your employees and customers? 50% said less than 10,000. 13% were between 10,000 and 24,999. 13% said I don't know, and 25% said NA. I'd love to know you guys' thoughts on that poll. I'll start with you, Dr. Tuckson.
Well, it's just interesting to me the economic choices and decisions that people have to make as they invest in their businesses. I'm sure that much of that poll reflects, first of all, the ability to devote resources. We have such different levels of discretionary capability across so many of these businesses. And so the issue ultimately becomes, what were the hard choices that people could make and then made, and what were the choices that people couldn't make? I certainly hope that none of the people who responded did so because of a sense of a laissez-faire, I'll try to get by. I thought that Arian's point earlier was really critical, as he observes from his very special vantage point. I mean, he's in a position to know that those who lowballed it, who tried to slide by, they were the ones that got hurt the most in the long run. They're the ones that will suffer in the long runs. Those that made the decisions to invest in their business today, just like you would make an investment decision outside of the pandemic, but now making an investment in the new resources that they have to have, the new capabilities that Erina talked about so wonderfully in her discourse a few moments ago. Those who invested in that will be positioned for the future. The part that I guess I am sad about, and I have a great empathy for, are those that didn't have the chance or the choice to make investments because they didn't have access to capital to be able to apply it. And so for that, I know that this is what the sponsors of this event, and all praise is due to our DC government economic development colleagues. These are the businesses that need to be brought forward, who said, look, I simply did not have the capital to be able to do what I needed to do. I've got the religion on this. I know what I'm supposed to do, but I don't have the capital. And I'm hoping that now that things are a little more stabilized, that they will be able to have access to capital to make the kinds of investment that they need to make.
Thank you, Dr. Tuckson. Erina, any thoughts on that poll?
It's hard to make any conclusive decisions based on that without knowing what it is that they're spending money on, but I can imagine that, some of the majority of the people who marked 10,000 or less, I would hope that they're on things like making sure their bathrooms are properly stocked with, soap and normal cleansers and hand sanitizers, perhaps providing masks or gloves if necessary to their employees, perhaps, more investment in some, cleaning supplies. I'm not in like some of the higher end things that just aren't going to be feasible, such as that might have been recommended, like, redoing your entire HVAC system to make sure that you are circulating, fresh air and not recirculating contaminated air. That is definitely going to be a higher cost. And it may also be something that business owners don't have any control over. If they're a renter in a building, that even if they wanted to invest, they might not be allowed to invest in something like that. And that goes back to, like, we do need to make, community efforts.
Thanks, Erina. Arian, any thoughts on that poll for you, Arian?
Yeah, so I think for me, it is disheartening. And I'm going to try to phrase this the correct way. Several months ago, when Mayor Bowser came out and she was frustrated about the amount of COVID relief that we were receiving from the federal government, I think it shows up in polls like this. As a public health professional, this is not about politics. It's about helping people. And because we were shortchanged, I think it hurts. So I think we've attempted to provide relief packages at our level, at the district level. However, without the appropriate resources, it's tough, and I think it showed up in that poll.
Absolutely. Thanks, Arian. All right. We're just about out of time. Any last remarks from anybody before we go into our Q&A session?
One thing I'll just briefly just come back to is I think what this pandemic has certainly shown is the ethics of our relationship between one human being and another. I really do hope as we look to the future that we now understand that what it really means to be all in it together, that what I do affects you and what you do affects me. I think this predicate of love and caring is very important. I don't mean that in a abstract, silly way. I'm a private sector person. I spent the last 14 years of my career as a Section 16 officer of a Fortune 20 company. So I am very focused in on private sector entrepreneurial and business realities. That being said, what we have learned from this pandemic is that we have a moral and ethical responsibility, one person to another. What I do affects you. What you do affects me. I think we have to build upon that now in a new way, whether it is the relationship between the business owner and their customers having been propelled to a higher level, whether it's the relationship between different competitors in a business, whether it has to do with the relationship between business and the rest of the society. We truly are in it together in a way that has absolutely life and death consequences.
Wow. Thank you, Dr. Tuckson. Any last thoughts, Erina or Arian?
Just that, public health is community health. It's about building safer communities and more resilient communities. And as Dr. Tuckson said, I think he said it better than I could. It's just like, we need to take care of each other and realize that we really are in this together, human to human. It doesn't matter if you're employee, employer, what your level is, what your status is we need to work together towards the same goals.
Thank you, Erin. All right, so jumping into the Q&A session, okay? Pamela Moyer asked, even if employers take every precaution to keep staff as safe as possible, there is still the risk of someone falling ill. There is nothing that is 100% foolproof. Should employers be asking staff to sign waivers to walk in the same way that clients have to sign waivers to receive services? To work, I'm sorry. in the same way that clients have to sign waivers to receive services?
Erin, are you the expert?
Yeah, yes. Not yes to signing waivers, but yes, nothing is 100% foolproof. Like, we're doing everything we can. And I think, honestly, that is a legal question that I would not feel comfortable answering, a straight yes or no on waivers.
Mm-hmm. Okay. Lisa Booth asked, what are the key steps that should be put in place in the workplace to ensure safety for staff and customers coming into space? Should we install plexiglass? Should we take temperatures? It's dizzying to figure out what to do.
I can answer part of this question. So, and we do this in our government buildings as well. So we do ask for a screening. So it's a set of 3 to 5 questions to see if you've come in contact with anybody with COVID. Do you have any symptoms? Have you been to any of the places that are on a list where you are required to quarantine? That sort of thing. Now, unless you're a trained health professional, we do not recommend that you take temperatures. There have been cases of people self-contaminating by taking temperatures incorrectly. So I don't think that is something that we want someone, unless you're trained to actually do it and you have the appropriate PPE to take temperatures. We don't want you taking temperatures.
And the other guidance is pretty straightforward. I mean, look, we know that I think Erina talked about the ventilation systems are important. You need to make sure that that's squared away. Yes, you should use plexiglass shields if you cannot guarantee that people are going to be 6 feet apart. And even if you can, that's probably still a good idea. Yes, you have to make sure that people are being compliant with masks. You definitely want to make sure that people are not congregating as they work, as they move about their office environment. You don't need people congregating in indoor environments like where common eating areas where people will be exposed for prolonged periods of time to the vaccine. You know the basics, and you ought to be doing those basics every day. Yes, it may be, as you say, dizzying in terms of the number of things, but it really isn't that many. It's pretty straightforward. And I don't think you should be overwhelmingly confused about what to do. But on those issues that are legal, that's another issue, and that does require a very activated human resources person to consult with you on. But as far as the physical distancing, the mask wearing, the hand washing, the availability of sanitizers everywhere, the non-sharing of tools and equipment, the non-sharing of items and objects between individuals in an office, all of those are basically, common sense at this point, and you should be able to handle that pretty easily. Don't be intimidated. You can do this.
And Dr. Tuckson, when do you recommend employees get flu shots? Now, October, November?
Great question. And I think you should start getting your flu shot about now, the last week of September, certainly the first week of October. The reason that we don't want you to get it too soon is because we want it to last throughout the flu season, but we want you to get it 2 weeks before the flu season starts. So this is about a pretty good time right about in here. I'm getting mine at the end of this week. If you are a senior, or you are the relative of a senior over 65, you want to ask for the senior edition of the flu shot, which is a little bit stronger. For kids, yes, anybody over the age of 6 months should get their vaccine, and there are special formulations for kids. Please, please, please do not fall victim of the Russian bots and the white supremacists who have invaded our social media world, somehow telling us that if you get the flu vaccine, you can get the flu. The virus for the flu is not in the vaccine in a way that is live and that can be transmitted to you. So please do not fall for those who are deliberately trying to engineer our deaths.
We have another question. And this one looks like, Arian, maybe you can help answer this one. What are some implementation strategies restaurants and bars may consider? Some implementation strategies for restaurants and bars.
Yeah, so a lot of this information is on our website at coronavirus.dc.gov. But things things that you normally do, sanitizing, make sure that you have available sanitizers, make sure that your employees are washing their hands. There are also some creative strategies. I know space is at a premium in the district, so you may have a very small kitchen in your restaurant. You may want to schedule your team so that they aren't working at the same time. And I know we all enjoy freshly cooked meals, but it may be beneficial to prep the meal beforehand so that whoever's prepping your food is not there at the same time as whoever's cooking the food. So it's things like that that will help out.
Thanks, Arian. And another question, can any of you guys talk about the COVID-19 myths that are circulating through the public? What to believe, what not to believe, any myths?
There are a zillion of them. It started out with people of color couldn't get the COVID virus. That was the first big one. The second big myth is that masks don't work, which of course is total nonsense. And anybody that follows the leadership or the advice of the person occupying the White House today is a total fool. Do not listen to that nonsense. Masks work. We know they work. The myth was that you couldn't breathe in a mask, or that if you breathed in a mask, you would be breathing back the virus itself and it would make it worse. Nonsense, foolishness. Don't listen to it. Those are the biggest ones. And then when it comes to the latest myth du jour is that on a COVID vaccine, I did a couple of national radio shows recently, and I couldn't believe it that people called in and said that Bill Gates is trying to inject nanotechnology robots into our arms through the process of vaccines. I mean, just absolute insanity. But you know, that is going around our community. So that's just some of them. If it doesn't make sense, ladies and gentlemen, realize it doesn't make sense. If you need facts, go to the CDC. Despite some of the challenges that we have with the CDC website, still go there, go to DC Health's website. And if that doesn't work, you have my email address, send it to me, and I'll be happy to try to get you the facts that you need.
Thank you, Dr. Tuckson. Any other myths you guys have heard, Erina or Arian?
There are so many. I think Dr. Tuckson covered some of the big ones. The Bill Gates one baffles me, because if we actually have that level of technology, I just want to know why my camera on my Microsoft PC doesn't work. I just fact check, look at multiple sources. Anything that is a myth that sounds like a large body of people are getting together about something, definitely fact check that, because sadly people just aren't that organized and leadership isn't that organized. Turn to your community, do the basic things that we know work. Wash your hands, use alcohol-based hand sanitizer, wear masks, keep physical distance from other people, don't congregate in groups.
Thank you, Erina.
One other one, Aisha, I just want to mention is that I'm also just particularly worried about, and it's really relevant right now, and that is people and how we go back to our churches and how we deal with churches. There are a number of faith leaders who have been really out there, not in our city per se, thank goodness, but around the country, who are saying, come on back into these large church environments and being indoors. And we have just seen a wedding not long ago where 200 people infected at a giant wedding. 7 people died who were not in attendance at the event, but who had been infected by those people. The other myth that is huge that we need to be really, really careful about is that the president running around saying that children cannot become ill from this and not transmitters. That's total nonsense. And tell that to the children that have died from this disease. And again, I mentioned to you that we remember that simply because you survive COVID does not mean you survive it without secondary consequences or sequela. That is very important. If you look at what's happening on our college campuses today, and now we realize that 40,000 of our people, of our children who have gone back to college have been infected from this virus around the country. 40,000, and I fear for how many of them are going to have challenges down the road. So these are some of the myths also that really are decisionable for parents as we start to think about what's going to happen with our children, whether they're very young or whether they're college age.
Thank you so much, Dr. Tuckson. So we're just about out of questions. I don't see any more questions popping up in the Q&A. I just wanted to say that you guys did an amazing job, such an amazing panel. You guys have already given your last remarks. Anything else anybody would like to say at all?
Just what an honor it is, and thank you for being the moderator and my colleagues. I've enjoyed, I really would like to be able to get access to the transcript because Erin and Arian have both given a level of detail that I think all of us need to have available. So I do hope that there is a way that we will all be able to go back and pull up their comments and their guidance going forward. And lastly, we at the Black Coalition Against COVID, people like Marie Johns, the great business leader, Reverend Tucker, Reverend Curry, Reverend Lee, Josh Williams, Liz Davis from the Teachers Union, and of course, Antoine Ford, Corey Griffin, Phil Reeves, all these are people that we are lucky to work with at the Black Coalition Against COVID. And I think we're going to continue to be a service in partnership with and with the great kudos that are deserved by our DC government and our DC Health Department.
Thank you so much. Thank you.